Okay, so who's working on tobacco prevention and smoking cessation in the upstate? So we have a variety and a very diverse group that are working on tobacco and at different levels and at different settings as well. And so we take pride in that. There are just so many things going on that we don't want to miss an opportunity to provide some of the resources, the products and things that we do. And this has been something that has been near and dear to our hearts for a very long time. And I know I saw Sharon on earlier, and she knows that we just love our partnership internally with the division as much as we, as we can do. We're constantly reaching out to the division on what else can we do. And you'll hear shortly about a upcoming webinar that we're going to be doing as part of the Great American Smokeout, that we always can reach out to our central office, to the division, and get anything we need and any support and resources. And so we take advantage of that. So talking about who's working on tobacco, internal partners, of course, is going to be that great partnership we have with our division. But then we have a core team, or the community outreach resource and education team, which are our community engagement specialists, that they focus on the bulk of the tobacco work that's being done in the region. And they do that through partnerships. They do that through coalitions. They do that with sometimes even on individuals who may ask for additional resources. They take time to share that out. But we also have our outreach team, which is our health workers who also do some of that outreach as well with the individuals and small group that they may be providing that information and education on smoking cessation in the community. Then we have a program that I'll take a little time in a few minutes to share with you about the Baby and Me Tobacco Free program, which is also community engagement specialists who are working on that program, sort of working with our moms who may be smoking so that we can maybe help ensure a healthy mom and baby. And then, of course, we have our clinic teams who are making referrals to both the Quit Line and to the Baby and Me Tobacco program. Our external partners are huge, could name them all here. And this may be where I ask, some of my team members, if they do have additional ones. I'm just mentioning some because this is not a comprehensive list at all of who we work with, because it just depends on the time that we're working with them or what's at hand, what event may be at hand, what we're planning. But some of the more recent ones, of course, I want to thank Smoke Free SC again for having us on. And we always are on the website utilizing your resources to do most of the work that we're doing, especially the data and other great information you have. And we do enjoy these roundtables to keep us updated with what's going on across the state. We have a very recent partnership. It is really a long-standing partnership that we have just sort of reestablished. And I think that he may be on as well. Mr. Clark would just say something. And we actually are going to be doing that webinar with him as one of the speakers on that webinar. So we'll talk a little bit more about that in a moment. And then, of course, a specific one that I'll just mention just because it's also sort of fresh, right out of the table, that the Anderson Oconee Behavioral Health just recently received some assistance from our core team as well as I think, and Misty, if you're on, you can definitely correct me, but as well as they just received the smoke-free palmetto certification. And if they didn't, it is another one that I might be confusing, so forgive me for that. But I know that they just recently been involved with the Anderson Oconee Behavioral Health. And then there's several other community health coalitions and organizations that, as they have identified smoking as a priority in their communities, they do that through the community health assessment process. They have identified smoking cessation or education or information. Some of them have identified the youth population as a focus population. Then they may develop some objectives around smoking cessation to education in what we call their community health improvement plans. So after they've conducted an assessment, which may take anywhere from a few weeks to a year to complete, where they do paper assessments, they may do focus groups, forces of change sessions, they do work groups, they do all kinds of things to really assess those priorities and then determine what are some strategies that they can do to move forward. Those are happening throughout most of our counties in the upstate within their community health improvement plans. And so I'd like to pause just for a moment just to see if there are, and I can't really see people, so I'll see names. So if Barbara, I'm not sure how we want to do that, but if one of my team members has additional examples that they'd like to share about the external partnerships that we have, please sort of chime in at this moment.
Lillie, this is Misty. I'll just clear out the Anderson-Oconee Behavioral Health.
Okay.
Our partnership is very long with them, but what we most recently did with them wasn't smoke-free Palmetto certification, but we have provided signage for them for their new facility in Oconee that just opened.
Awesome.
But we've worked with them for years with Quitline. They're one of our better partners for working with Quitline with the patients that they serve in the community, both in Anderson and Oconee, as well as, of course, their primary focus is behavioral health. And of course, they do a lot of MAT work in the community, but they're really a strong proponent for addressing tobacco use with their clients as well. So
Awesome.
just to clear that up.
Yes, ma'am. That's kind of what I was hopeful for. Thank you so much, Misty. Misty is one of our core team managers here in the Upstate, along with Mr. Vale Ford, also a core team manager in the Upstate. And then Brianne Alexander is the one I'll introduce with the Baby and Me Tobacco Free as our manager for that. And Tiara Scott is our manager for the outreach team.
Yes, and if anybody wants to chime in, all they have to do is unmute themselves and we will be able to hear you.
Awesome. Thank you. All right, so moving right along to some of the programmatic resources that we use, and a lot of these are going to sound very familiar to you, but we just want to kind of highlight those things that we're specifically working with and making some concerted effort to do. And that, of course, is the Quitline. For one, and we do so many different, we promote the Quitline in different ways. Not only do we do it with those community groups and partnerships that we're constantly working with, we make sure that we sort of keep this information on the forefront so that we know that when opportunity opens up, we're ready to promote it, even if it's at the individual level. That's where the community health workers may be doing that at a tabling event. They may be doing it one-on-one, but also, all of the community engagement team members may engage at any level with helping to get these resources out to where they belong when the time is presented. We, of course, work with our clinics, our internal and external promotion of the 2A's plus our brief intervention and the Quitline referrals, big time into the Quitline. And just recently, we found some renewed interest and hopefully becoming Quitline referral partners and really getting them the information they need to get trained so that they can continue to do this. So we're constantly promoting the Quitline. We're recruiting providers. We're also making sure that they understand where they can get the training from and promoting that they can get CMEs. We also promote that internally because Misty Lee, who you just heard speak, is also our trainer for our internal staff. So she makes sure that clinic understand how to make internal referrals so that we can keep those numbers up. But at the same time, we're recruiting externally to make sure that providers have both resources they have and know how to access additional resources, as well as keeping them up to date on the information from all of the partners such as yourselves that's on the call. Then, of course, one of this, and I know that Quit the Hit is still sort of being negotiated. And Sharon, please correct me if I'm wrong on that. I know that it's currently still being negotiated, but I do have a video I just want to share. That's an awesome opportunity that is going to be part of the highlight of the webinar that we'll be doing from the Upstate. And so I will share a little bit more information on that in just a moment, as well as Baby and Me. And then I wanted to quickly just mention this. I know that the CDC Work at Health, which is a worksite wellness initiative, I wanted to mention that because that's another avenue that we utilize to get information out. We don't just when we get a request in for anything around tobacco or the Quitline or educational materials, we are constantly keeping that on the forefront on opportunities. And one great way to do that is through worksite wellness. That a lot of times that's where they're able to both become providers, referral partners. They can be education hubs. They can get information out. They can help participate in some of the health observances, like the upcoming Great American Smokeout. There's just so many things we can get them to be a part of that meets more than just the issue at hand. So if we're focusing on tobacco prevention, we may be working with them with other worksite wellness around nutrition and other things. So we do things in tandem often on the team when we do it. So it's not just one focus. We try to, if I may, sort of hit two birds with one stone. I love birds, by the way. Don't want anybody to think that I hate them, just a little saying. So now let me mention just a little bit, dig a little bit deeper into a couple of the things that we're doing kind of more recent right now. And this is an ongoing program, of course. And as I noted, Brianne Alexander is our manager for this program. And I kind of pulled these slides right out of a presentation that she uses often to share, but I will just sort of hit and miss some of the information for those who may not be familiar with the Baby and Me program. It is a program for South Carolina pregnant women who are at no more than 36 weeks gestation. They're a current tobacco user or have quit since becoming pregnant, or who have quit within 3 months of becoming pregnant. The Baby and Me program, BAM, as we like to call it for short, offers support partner enrollment to increase the likelihood that a mother can quit using tobacco successfully. The support partner must live with the enrolled mother and can include spouses, live-in partners, parents, or close friends. The support partners complete the Baby and Me tobacco-free program alongside the mothers. There are no age, income, or insurance requirements for the program. But note that the Baby and Me tobacco-free program provides quit support to mothers for all tobacco products, including smokeless products and e-cigarettes, vapes, but only provides quit services to the support partners who use combustible products like cigarettes and cigars. So the incentives that come in with this program can be received by both the mom and that support partner. And that's basically what this next slide talks about, is this kind of the components of the program. And there are four main components: the health coaching, which is the individualized counseling. There is and each one is assigned one, and Brianne has a caseload, and so does her staff also has a caseload. But while enrolled, the mothers attend 4 prenatal sessions and 12 postpartum sessions that last approximately 15 to 25 minutes each. The scheduling is done either on site or on location, but they are flexible because they also can do some virtual telephone appointments. The health coach assesses the mother's needs and schedules in-person sessions and telehealth sessions. Enrolled mothers are supported with a variety of education and coaching strategies, including stress management, controlling triggers and urges to use tobacco, the effects of second and third-hand smoke on their health and the health of their baby, creating a tobacco-free home and preventing relapse. And along the way, the health coaches use positive reinforcement through motivational interviewing training and provide additional resources as needed. This is another one of those places that not only are they doing these 4 components with that mom, if there are other wraparound resources, whether it's WIC, which is an internal nutrition program with the agency that they can refer them to, if there's other resources like oral health, we have what we call Smile Kits, and we have a perinatal component of that. So there are so many different ways that we sort of wrap around the services that we do. So it's way more than what you see that these moms and their support systems are receiving. So I wanted to take a moment to definitely highlight the Baby and Me program, because what we found is a lot of people still are learning about this program. It is available across the state now, but for a while it was only available in the upstate, and then more recently, the last 2 or 3 years in the Midlands, but it has been now fully open to the state. And right now, Brianne, her team, and Mr. Mike Lee at the Midlands are sort of covering the state.
So Lily, we have a couple of questions, and I saw
Sure.
Dr. Keeley had his hand raised. So,
Okay.
Dr. Keeley, did you want to say something?
Yeah, when you were talking about the different approaches, I wanted to ask you whether you have any some certified tobacco treatment specialists in your region, and if so, where they are available.
That is a great question. The team that works, the Baby and Me team, are a certified tobacco treatment specialists, and they renew their license each year or as needed each year, but we do have at least a couple in the upstate. And then I believe that Mr. Lee is also a tobacco treatment specialist, and then there may be others in the other regions as well. But we do have some on staff.
And were they trained within the Department of Health, or where were they trained?
Their training was received through, and someone may want to chime in and correct me, Sharon or others, but it is it's a national training. They do receive ongoing training and refresher training along the way, but they are certified through the national program that I believe out of tobacco, and the name escapes me, in Georgia.
Yeah,
But
it's the Duke University program.
Thank you,
The
Sharon.
Duke University Certified Tobacco Treatment Specialist program.
Perfect. Thank you, Sharon.
Yeah, sure.
And thank you for that question. Any other questions before I move on?
We have one in the chat box, Lily, that is, would a mother not be eligible then if they did not have a live-in support partner? Like if they are single and living alone?
Oh, no, they do not have to have a partner. That's just an added incentive if they do, because it does build the support that they will sustain and they'll continue to stay quit. So that's why we offer that, so that if they do have a partner, it can even be a mother that's living in the home with that pregnant mother. It can be her spouse. It can be just, another person that is supporting that mom, and that incentive, because they do get a card to get diapers and baby wipes as part of this incentive, and that can double with the support that they have.
Yeah, I think there's data out there that says that if there's a combustible tobacco product user in the household, that the percentage success of the pregnant mom being able to cease tobacco product use goes down significantly.
That is correct. And that is a lot of information behind that science. So thank you, doctor, for that.
And then Lily, Sharon put in the comments that they are full go with the next iteration of Quit the Hit. So it's active and recruiting now.
Awesome. So that's perfect timing for the next slide. Appreciate that, Sharon. So I have a quick little video, 30 seconds, just kind of show you what Quit the Hit is. But as I noted, this is sort of one of the highlights of the webinar that I'm going to introduce to you all in just a second. And Misty and other team members can definitely chime in on that. But we're excited to do this. And we sort of do everything we do is sort of behind science, if you will, to make sure that we're following the data and we know what hot topics are. And we know that youth vaping is one of the hot topics and has been for several years. And really, what are some of the strategies that we can do? I know Smoke Free SC has some great resources. Our division with Sharon and others have great resources, including this Quit the Hit. But this is one that we want to focus on as one of the tools for youth as our topic for our next Great American Smokeout event. So I'm going to play this video real quick.
You've probably heard the news about vapes by now, all the dangerous chemicals and metal particles they're finding inside, and how they're damaging lungs and making people more likely to get sick. It's pretty bad. That's why thousands of teens are trying to stop vaping, and to help, we created Quit the Hit. We provide free and private support groups on Insta that connect you with other teens who want to stop too. Get tips and proven strategies developed by experts to fight addiction in a chill way. Plus, you can get cash just for participating. So, ready to quit the hit? Sign up now.
So you can kind of see that, and I went one too fast there. There we go. You can kind of see that that ending, the way it ended, that you can get some cash. I'm pretty sure that's going to pique the interest of many of the youth to kind of jump on board on that. So we're looking forward to helping promote that and really get some youth to quit vaping for this Great American Smokeout season. So next, I want to kind of mention some of those community products that I talked about earlier, in addition to the education and information that we provide, and that's something that sort of stays on our radar. We do have some concrete products that we utilize to support our efforts and the things that we do. Again, these resources come from all over, specifically internal partners, external partners, and then resources that are shared between partnerships. And so one of them, of course, is our general community prevention education presentations. One example is one that Misty shared with me that I want to use here about oral health and tobacco. Again, two birds with one stone. It's not that we go in and just talk about tobacco, give the education, focus on those programs, unless it's a specific program like Baby and Me that has a defined purpose. And even then she does wraparound service. They do wraparound services. But here, we also want to spend the time to really show connections where we can. And if we can show a connection between oral health and tobacco, which a lot of people tend to overlook that, or that's something that's kind of set aside. We have a broader scope that we can help with holistic prevention around tobacco, prevention and education and cessation. So we try to do that at every corner that we can. And more recently, that has been what we have really focused on when we're out in the community and working with coalitions and groups. As soon as we see that they identify that as a priority on their assessments, we go to work with defining and aligning resources and education and information with those efforts. So it's a constant effort. Then, of course, we have tobacco signage, as you heard Misty mention earlier, working with the Anderson Oconee Behavioral Health, making sure that they have signage to really promote their efforts and their policies that they have in place. Our quick kits is one of our capstones, and that's what you see in the picture here. It is just that. It is a kit to sort of buy a little time, sort of help to get the individual into the stages of change. Most of you may be familiar with that theory, sort of getting them ready. And if they want to, we want them to start contemplating, getting ready. What are some tools that they can use to support and encourage themselves? Have the resources like the palm card that you also see in the picture, but even things like the mints, instead of popping that, cigarette or vaping, is there something else you can use? And even some stress items in there, the gum. So you see different things that can help promote and remind them to stay quit along the way, to give them that self-support. But at the same time, they also know that they have the other resources available to reach out to. And then I mentioned the smoke-free palmetto certifications earlier. That is, in order to become certified, local governments must adopt and implement clean air protections that prohibit smoking and the use of cigarettes and vapes in all indoor workplaces, restaurants, and bars. This like we noted earlier, was most recently presented to a couple of our partners, and we're constantly, again, looking for opportunities to do that as well, to recognize and award those municipalities or those entities, organizations that are really making these efforts to really promote the prevention as well as cessation. And I want to mention this, and this may be a little bit behind the times, but I wanted to note that as of, I think the latest data, Sharon, was as of 2022, we have 14 smoke-free municipalities across the upstate region. So that is still also something that we consistently work on. Look forward to continuing the education as the opportunities arise. But we provide technical assistance around that with not only the city and county ordinances, but we are still looking for opportunities to do smoke-free housing with multi-unit housing. We also, when the opportunity arises, provide resources and information for our continuation of tobacco-free schools and that effort. So again, we just have many different ways that we are working, and it is consistent. It's not something that we just do at a certain time of year. This is consistent efforts throughout the year. And my last slide before ending is just want to mention like I said, sort of whetting your appetite along the way about the upcoming event. But I wanted to mention this before we talk a little bit more about the GASO webinar. In the events, you heard me mention earlier that we make very strong efforts to include opportunities for tobacco prevention, education, promotion of the quit line, all of that at any given time that we can. And we do that throughout a lot of the outreach events. And sometimes we have a strategic effort. One more recent was that we attended the South Carolina chapter of the American College of Physicians, the scientific meeting they had here in Greenville last week. And what we did at the table was not only use the opportunity to share information about the quit line, but hope that we have several of the physicians who stopped and said, hey, what is this? How do we get involved? Can we become an electronic referral partner? Can we, how do we do this? And we actually, I think the last count was 5 that shown interest, 4 of them really wanting to really get involved. So using that opportunity to provide that information to them, we even shared the Baby and Me program with several, just in case they were OBGYN specialists that were there. So we were able to get the information out like that. And we do that quite often at events, but we also plan specific events if we can and have the capacity and resources around certain events like the upcoming Great American Smokeout. The Great American Smokeout is actually on the 21st, but the webinar that we're planning to do in the region is going to be entitled Time to Talk. And it's focusing on youth vaping. So we're going to try to provide tools for schools and youth organizations. And one of them is to Quit the Hit that you heard me mention earlier. That is going to be on Wednesday, November 13th from 3:30 to 4:45. And more information to come. We do have the flyer and other registration information that's being developed as we speak, and hope to have that out very soon, maybe early next week, so that we can get a lot of promotion going on about that. And I believe that that is all that I have, but I think I saw some questions come up.
Yeah, can I chime in? I have 2 questions. One, when you listed the schools, are you also including colleges and universities in your region?
When we can, we do. We have great partnerships with our colleges. We have not had a focus strictly on the tobacco education and information, but when we go and do events with them, we always take that information and share. Our latest topics have been more around opioids, as you can imagine, some other behavioral health and mental health topics, as well as specifically things like Narcan, really talking about education information around opioids and things like that. But we do have great relationships with just about every college here in the upstate, working through our academic public health department, that we have partnerships there, and we work with them to do things such as data walks. And when they invite us to their student population events, like recently we done maybe 2 at Furman. One of them was around STD and HIV, but while we're there, we spend that opportunity to present a gamut of information to them. So we partner in that way, and if a student council or student government at any of those schools reach out for information and education, we already have that established relationship to share with them. So not a concerted effort that we're going on the campuses that way, but we have provided tobacco cessation and information materials to them as we're there.
Mm-hmm. Yeah, I think the having the student voice is important, and then in the background you want to be looking at the Board of Trustees and see if you can find a champion to approach on the Board of Trustees. Yeah. Second question. Yeah, I'm sorry. Go ahead.
No, you go ahead. I was just saying that's awesome. That's exactly our effort. So I appreciate that.
Yeah, and second, it's not necessarily a question, it's a kind of a comment. What we've done in our region is we're talking about nicotine addiction. And that's our lead message. And it's because, you know, the commercial tobacco product industry has pivoted to these pouches, nicotine pouches.
Mm-hmm.
If we just talk about vaping, you know, a lot of the high school kids have moved on. And so we feel like the real target topic is nicotine addiction and the effect on the developing brain through age 25. So that's just a comment. I don't know whether you want to say anything about that.
I am taking that down as an effort that we will definitely look a little bit more into, because I really feel like that is the bridge to our both working with our high school as they transition into college and beyond. And I really think that that is, and it might be something that our intern is going to talk about as well. But I think that that is a bridge, and that is something that we probably need to open up a little bit more exploration on, as we are now getting into understanding more of how the numbers are looking for youth vaping, because we know the trends. We kind of have that data that's going to be shared a lot more at the webinar. But I think this is an added component that we do need to really focus and sort of hone in on a little more. So I appreciate that comment.
And I think Brianne had her hand up.
Yeah, I was just
Okay.
gonna address that. Dr. Keeley, we've actually taken an approach with Baby and Me that we've created some outreach materials that we use internally with our DPH team members to start to change the language when we discuss smoking. It's a standard screen, do you smoke? But we've actually created some like rack card information where we've asked them to change the language. Do you use vape products? How often do you use them? Because we do know that most, especially our moms that vape, they don't see themselves as traditional tobacco users. Well, I hit my boyfriends, I hit it, and we hear that quite often. So we've actually taken an approach with Baby and Me to encourage that change of language along the same lines as you were talking, looking at it as an addiction and changing that language from the sense of traditional smoking. So we've had that same thought process within that, and we are working towards that change of language that we've continued to talk about.
Awesome. Thank you for that reminder,
Yeah.
Brianne. And thank you for chiming in.
Mhm.
Awesome.
Any more questions? And I see that Yomi, Yomi has one in here. Is there a concerted effort to incorporate these education informative sessions to promote participation in adult and youth tobacco surveys?
And we wrap everything we can in our encounters and our engagement in the community. But that might be a question that Sharon, if you're still on, is that something that you can speak to?
I think when we have the surveys out in the field and those kinds of things, we do try to coordinate with our regional partners to help us educate in particular with the youth tobacco surveys, educate the school personnel to try to get them on board. So the Upstate Region's been great partners in helping us do that, as have the other DPH, excuse me, regions as well. Still trying to get used to the new name.
Same
But
here. Same here.
yes. But definitely the Upstate Region have been great partners in trying to help us reach into those schools. So definitely that partnership is there.
Sorry, that was not my intent to put you like that. But my intent was actually just to see if we could provide more information whenever we have these educational sessions. Just as a side note, that we do have these surveys in place, and just to let them know.
Got it.
Talking about the community. So it was not my intent. Just a disclaimer.
Got you. So you're just really saying that you utilize these platforms like the Roundtable to really note that we are doing those adult and youth tobacco.
Yes, that those resources are out there. Yes.
Yes,
well.
thank you. Thank you for that.
Great point, Yomi. Great point.
Yes.
All right. Any other questions? Dr. Hall, thank you so much. Great presentation. And we really appreciate you coming in. It was very informative. Tara put in the chat box for y'all to see that we are doing a presentation on Baby and Me. It was supposed to be last month's roundtable, but because of Hurricane Helene, we lost power in the office and lost internet for a couple weeks. And I know many people on this call were affected by it. So that will be on November 8th. And you can register in the chat box, or you can also go to our website, and Kimberly Gripper-Sims will be talking about that. And then I did want to point out that we have 3 board members on our call today. We have Andrew Wylam, Tammy Timms, and Brenda Jones. So I just wanted to say hey to them and thank them for participating. And also our community engagement coordinator, Deborah Dunbar, who is in the PD Low Country regions, is also on there. So thank you again, Dr. Hall. We really appreciate it. Hey, Deborah. And now we're going to go to part 2, which is vape disposal kits and what we found, or what our intern found when she did an assessment of the vapes. So I'm going to switch seats with her because we are down a computer, and let her take over, and I will share her screen. Okay. Here you go.
Hello guys, my name is Lucy Derrick and I was a research intern this summer. One of my main jobs was to go through the vape disposal kits that we collected from different schools across South Carolina. And I'm excited to share my presentation with y'all on my findings. You all see my screen?
Yeah, I can see the screen. I think you might have to do the button.
Okay, so an overview on my presentation. First, I'll talk about the preparation and preparing the vape disposal kits, how we drop them off and pick them up, and then the supplies needed to go through the vapes after we collect them. The process I sort of use to go through the vapes, and then how I enter that data into Excel. And then lastly, I'll talk about the findings. So brief summary of the vapes, from the brands, flavors, puffs, and the appearance. Okay, so for the preparation, this is what our vape disposal kit looks like. It's a clear bin and it has multiple stickers on the outside for hazardous waste warnings and also contact information. In the first picture, it shows the phone number and email to contact to pick up the vapes. And then on top of the bin, on the lid, is a sticker that clearly explains the disposal guideline procedures that need to be taken in order for us to collect these vapes safely. Inside the bins contain another informational packet or sheet that talks about the hazardous effects of vapes on the environment and also safe handling, storage, and proper disposal procedures for these vapes, along with a pair of gloves so people can pick these vapes up safely, and a plastic bag to place the vapes that have leaked or are broken. Okay, so the supplies I used for my vape kit audits include gloves, a face mask, and a fan. The fan's optional because a bunch of the vapes do emit fumes that can kind of like, they smell and then they can kind of like stick to your clothing. So I used a fan so I wasn't breathing in all these fumes along with the face mask. And then for cleaning, you can put these vapes on top of a tablecloth so your table's not sticky, or you can just wipe down the table with cleaning wipes after. So the process I used in the first image is kind of how I sorted the vapes by brands. I would count all the vapes in the bin and then I would sort them by brand and flavor. And so the second image is a screenshot of my Excel sheet, which kind of breaks down the different brands, how many are in each, and the same with flavor. And then there's a column for notes, which this bin in particular didn't have any notes, but some of the bins would contain other items such as confiscated lighters or beer salts or things that resembled vapes but weren't. So I included those as well. And then on the bottom in the highlighted sections is the total number of types. So there's 16 types of brands in this bin, and there's 17 types of flavors in this bin, and then the total amount of vapes, which was 34 for bin number 1. And I did this with all the bins that we've collected. So a brief summary of all the bins. There's 12 bins in total, and out of the 12 bins, there was 116 different brands, 83 different flavors, and the total number of vapes was 678. So this is also a screenshot of kind of how my Excel sheet looked. I categorized it by bin. So I marked down how many vapes for each brand were in each bin. And then the total, which you can see on the far right, is highlighted. And so I went through all the bins and went through all the brands and flavors and did this. So from the brands, I ranked them from the most found. So I found the top 10 most found brands, and Lost Mary was the most popular brand found with 90 vapes out of the 678. So I also calculated the total percentage from the 678 vapes. And another significant finding is that Raz was found in every bin, but it's not the most popular. It's the second most popular, but it's considered to be popular and widespread because it was found in every bin from all the schools. And then most of the brands were only found once. So I calculated that 60 out of the 116 brands were only found once, which means they're like smaller, lesser known brands, but they make up almost more than half of the percentage of all the vapes. So they made up a percentage of 51% of the vapes, which is pretty significant. And then the same with flavors. This is also a spreadsheet of the flavors that I found through all the different vape bins. And an X indicates that they that flavor was not found in the bin. As you can see, I marked each bin the same way as I did the brands, and then the totals calculated and highlighted on the far right. So with the vape flavors, I also ranked them from the most popular, most found, and mixed berries was ranked number 1 with a total of 58 found out of the 678. And I categorized mixed berries as 3 or more berry flavors together. A lot of the vapes, the flavor was titled mixed berries, but also some of them were just either like blackberry, raspberry, and blueberry. So I would categorize all 3 of those as mixed berries. And so none of the flavors were found in every single bin, but found in most bins were strawberry, mixed berries, and peach. So those were found in all but 2 of the bins. So they're also popular and widespread. And then 38 flavors out of the 83 flavors were only found once. So that means that 63% of the percentage of flavors were only found once, which is significant. And then I also calculated that 24 of those flavors were unusual. And what I categorize as unusual are flavors that don't specifically state a certain flavor, like Nightcrawler, Cactus Jack, and Elf Cloud are examples of flavors that I would categorize as unusual. Can't really specify what that flavor is by just looking at the label. And so I broke down these flavors by categories, and as you can see, fruit flavors are the most popular with 401 out of the 678. So 59% of the total flavors are fruit flavored. And then I also have mint, and then ice flavors, which are categorized as frozen or chilled or slushy kind of flavors, along with candy, desserts, and then the unusual, as I stated before, and unknown, which had no label at all. So there was no way to tell what flavor these vapes were. This is a better representation, a pie chart of the vape flavor categories with fruit, unknown, and unusual flavors taking up a majority of the pie chart. And initially I had candy and desserts together as sweets, but I think it's interesting to see that candy flavors like Skittles, gummy bears are more popular than just regular dessert flavors, such as just like gelato, for example. And so we also looked at the number of puffs for the per vape, and these are the top ranked 3 found brands in all of the vape kits. So Lost Mary, Raz, and Geek Bar. And between these, it's between 5,000 to 15,000 puffs per vape, which is interesting to notice. According to the Stanford Tobacco Reach Lab, 5,000 puffs equates to about 650 milligrams of nicotine, which is about 590 cigarettes. So between all of these different brands, it's between 590 cigarettes to 1,770 cigarettes just for one vape, which is really interesting and also significant because I feel like youths are consuming vapes a lot, so it's a lot of cigarettes within just one device. And then lastly, I wanted to look at the appearance of these vapes and how these vape companies are sort of marketing towards the younger consumers. And so in the top left are images of how these vapes kind of look like either like a sports energy kind of drink or just like coffee cup kind of miniature size, which is interesting to notice. And the popular brands that promote their vapes this way are Hyde and Licked Bar. And then also just how these vapes can also look and have weird shapes, like the next 2 images. But also how these vape companies are marketing with images or characters on them that kind of look like stickers in a way that I feel like is more towards younger consumers. But also just how in an opposite way, if students or I guess youths wanted a less conspicuous way of vaping. So Views is a really good company that makes their vapes look like, you know, flash drive. So like it doesn't look like they're vaping when it's not, you know, in their mouth. So I've had a lot of other objects found in the vape bins that are like highlighters or USB sticks that aren't vapes, but they look like them. So it's like a slicker way of concealing the fact that it's vaping for younger people. And that's the end of my presentation. Thank you all for listening.
Barbara, did you get any that had the video screen on the vape? More and more. We've seen those in our area where there's actually a game that you play on the little screen. Did you get any of those?
Pac-Man has a good example of like the little Pac-Man vapes, but we didn't see many that had like video game kind of characteristics, icons on them.
Yeah, this was great. Will we be able to get the slides that you
Yes,
showed?
I can share the presentation with y'all.
Excellent. Thank you so much.
Aaron, I have to comment, this is well done. I love the presentation. All I could see was just the numbers that she was showing and how those was well done when it comes to the visualizations of it all, which is what I do at DPH. I'm still working on that, but I just have to comment that it was well done. And also, it also elaborates, your presentation also kind of elaborates more on how we are seeing the pattern, especially when it comes to the flavoring. Of course, my only question would have been the ones that were marked as other, were they without flavors, or this is just flavors that could not be identified? Otherwise, yes, go ahead.
Okay, they just had no labels, so I couldn't tell what flavor
Okay.
they. Yes.
Okay, so it's very indicative of what we are seeing, where we are seeing most of young adults that are participating or having the addiction of vaping, where we have seen the number where 9 out of 10 of them are stating that they would not have been vaping if it wasn't for the flavoring that was involved, which is very big. So it's still pointing to how important the flavor ban needs to be possibly looked into to getting enforced in reducing this vaping epidemic that we have long term, such as stating. But overall, it was well done. I have to tell you that. Good job.
Thank you.
Could learn from that. I would learn from that. I'm learning from that.
Thank you.
Any other questions? Okay. All right, we'll switch real quick. This only having one computer wasn't really working too well today. Anyway, we will send out that presentation, and we're going to continue this. We learned from the first go around about some things that we might want to do next, which is we were going to try and sort them by region and maybe give you some more detailed information about that. I do think it's interesting as you have the brand names, but then you have a bunch that we couldn't tell who they were. And makes you really wonder where they're getting those and how bad of a product it is, you know, so that's a little worrisome. And then, you know, you can tell that these are children to a large degree because they're buying cheap products. So, I mean, some of them are going to have money to buy something that might cost a little bit more and have a cute design, but a lot of these products were very basic without a lot of labeling on them. So that worries everybody too. So we really appreciate that. It was great. Great job to my daughter. I appreciate that. Anyway, I think that's it for today, guys. We appreciate it. We had a full hour, and we will put this recording up on our website. We will send out her presentation for others to use. And Dr. Hall, I was going to say, if you send us your flyers for your event on November 13th, we'll be happy to distribute that to our mailing list.
You got it. Will do.
Okay, thank you so much, everybody.
Bye.
Bye-bye.
Yeah, thanks to everybody. Great meeting. Thank you. Yeah.
Thanks.